Welcome to Health Diary. My name is Winnie Lubembe and we're coming to you from 4 Points by Sheraton right here in Hurlingham. Now, cervical cancer is one of the most treatable cancers if detected early, but at the same time, it claims more than 3,000 lives. Why is this the case, and what can we do to make sure that a lot of women get access to proper treatment? We have that discussion in just a moment, but for now, here is the fact of the matter. Cervical cancer is a type of cancer that occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. It is the fourth most common cancer among women globally, with an estimated 604,000 new cases and 342,000 deaths in 2020. Cervical cancer is one of the most successfully treatable forms of cancer as long as it is detected early and managed effectively. Cancers diagnosed in late stages can also be controlled with appropriate treatment and palliative care.
2015 ndio niliendanga nikafanywa screening. Ilikuwa kuna maumivu, uchungu hapa chini ya tumbo. Alafu inaenda inasimama kwa mgongo. Yaani nikiinua vitu mzito. Ilikuanga hivyo. Sasa ndio nikaamua nikaenda hosi nikaangaliwa. Sasa after hizo mapasi na matesti mingi. Sasa ikakuja ikapatikana. Nilishtuka. Sababu kwanza venye waliniambia hivyo nilirecall. Ndio hata mamangu nilisikianga alikupanga nayo. Sasa nilishtuka. Kai nitakufa na ile uchungu niliona mamangu alikufa nayo. Alafu watoto wangu nitaachia nani? By then nilishtuka. Sasa ndio after hiyo process yote 2017 nikafanywa surgery ya kutoa uterus. Sasa unaona after surgery sikupitianga hizi zenye napitia sasa hii radio na nini. Of which ndio nafikiria ni kama ndio ilirika December last year. Sasa ndio nikaanza kubleed ile severe. Sasa si ndio nikaamua tena nirudi. Walikuwa ananiambia iko stage 2. Nilikuwa nafanywa MRI, CT scan, ultrasound. Sasa ile nilitoa vizuri ni biopsy. Hiyo ndio ilionyesha vizuri. Bekurudi ili hama penye ilikuwa ikaenda pelvis. Sasa hapo ndio ilipatikana imejificha. Sasa ndio sasa nikaambiwa haraka niende Texas nianze matibabu yangu ya radio na chemo. Nikafanya 28 sessions, radio 28 na za chemo 5. Na nashukuru Mungu nilimaliza niko sawa. Sasa natarajia kwenda Nairobi Hospital booking ya black therapy. Lakini nashukuru Mungu kanywele kangu akakungoka. Hiyo ndio nilikuwa naofia sana. NHIF ilinisimamia for 20 sessions. 8 nikaambiwa nijisimamie, but kuna wenye walinisimamia marafiki wa mradi mwingine inaitwa Heart Africa, Health Education Africa Resource Team. Niko na maumivu lakini ile tu kujikaza. Lakini nikikumbuka penye Mungu amenitoa mpaka saa hii, nashukuru Mungu. Kuna chanjo yenye inapeangwa wasichana inaitwa HPV, Human Papilloma Virus. Wanaweza peleka wasichana wao ndio wasijipate kwa janga la kansa. Na wakisikia pale kuna screening wanakimbia haraka. Juu ikijulikana mapema inatibika mapema. Wasigoje mpaka ile dakika ya mwisho tunapeleka uko kwa kitanda unabebaniwa. Nakimbia tu unatibiwa.
All right, let's get to know more about cervical cancer and, of course, the statistics in the country. And to help us with the discussion, I am joined by my immediate right is Jen Awino Oke, who is a cervical cancer survivor. Thank you very much for joining us today. And, of course, we also have Dr. Catherine Nyongesa, who is one of the top oncologists in the country, and that is at Texas Cancer Center. So good to see you, Dr.
Yeah.
Now, let's just begin with very basically the statistics in the country. Because according to, again, the statistics is that, cancer is actually the third leading cause of death in the country, but just narrowing it down to cervical cancer. What are the numbers in the country?
Yes, cervical cancer is one of the, I would say, second commonest cancer in women.
In women, yeah.
And actually second commonest cancer in the general population. We see about over 5,200 new cancer cases every year. Unfortunately, over 3,200 succumb to the disease. And this is just because of maybe lack of awareness, late presentation.
Yeah.
And I would say cervical cancer is one of the most preventable
Types
cancers.
of cancers, yeah. But let's talk to Jane. Your story began in 2012, right?
Yes.
But in 2013 is when you went to the hospital. Yes. So take us back to 2013.
Nilijipata 2012 ndio wakati nilianza kubleed. But nilikuwa nachukulia kawaida kama juu nilikuwa natumia family planning. Nikafikiria labda ni shindano. Kajaribu kuongea na marafiki zangu. Wakaniambia hiyo ni kawaida tu, shindano, family planning itaisha. But ikaendelea sana. So ndo nikaongea na one of my friend, akaniambia niende nifanywe screening. Wakani screen, wakaniambia hauko sawa, wakanichoma. After month tena nikaenda tena wakanichoma. Nikawa niko mzima, nikawa naenda clinic na nikajua nimepona.
Okay, kuchoma walikuambia ni nini?
Waliniambia niko na virus zenye zina cause cancer, but ijakuwa cancer. Yes. So after that nikapata mimba. So after kuzaa mtoto, venye nilikuwa na mimba sikusikia chochote. Mtoto kufikisha miezi 8 nikaanza kufeel tena siko venye nilikuwa, but sasa siko na bleed. Sasa nasikia tu mgongo inauma. Nasikia pain kama zile za cramps chini ya tumbo. Tukienda hospitali wanasema hii ni infection tu ya mama. Wananipea dawa but haiishi. Nilirudi SOS, nilitibiwa. Venye nilikuwa naenda huko waliniambia tukikuangalia tuone ni cancer, tutakutibu, tutakutuma Kenyatta.
Okay.
So wakati nilifika hapo wakaniambia hii hatutaweza, hii tunakutuma Kenyatta.
Kabla ufike Kenyatta. So Dr. Jane has pointed out a few things. One of them is the fact that, she just felt something, went to a hospital, akachomwa. And I'm pretty sure some people are struggling to understand, iyo kuchomwa, what does it mean?
So this cervical cancer, in our setup, I would say over 99% is related to HPV virus, human papilloma virus. This virus is sexually transmitted, and most women, they fight it off when they get it. In fact, by the age of 50, 80% of the women have fought off the virus. But there are certain times the virus can persist in the cervix. Then it changes the lining of the cervix. It infiltrates the DNA of those cells and may cause cancer.
Okay.
Before it gets to cancer, we call it precancerous stage,
yeah.
Whereby it can be diagnosed if you go for screening. When they notice that you have those HPV changes on the cervix, it can be treated. So by what she went through, like cryotherapy, just to burn it, to freeze those cells before to stop them from multiplying and form cancer in future.
So some of the symptoms that maybe people should be on the lookout for, especially when it comes to cervical cancer, because for hers it was like a bit of pain here, a bit of bleeding here.
So common symptoms of cervical cancer, number 1 is abnormal bleeding. You may also have a discharge, vaginal discharge. In the early times it is not false smelling, but with the time it can get false smelling with a bad smell. You may have pain on intercourse. You may also have spotting after coitus. Those are just some of the symptoms. But when it's in early stages, there are no symptoms at all.
Okay.
And many women confuse these symptoms with the infection. So it is good that they screen you for cervical cancer.
And earlier on you talked about, again, HPV being sexually transmitted. And someone might ask, so but for the men, so what usually happens?
So the HPV virus is actually available on body surfaces, yeah, in the genital area. So it can be transmitted, even in the throat, it can be transmitted.
Okay.
Now, what happens with the men, in terms of hygiene, it's much easier. When you go shower, that virus, you can shower and it gets off.
Oh,
but for women, it's a bit tricky,
exactly, yes,
because of the anatomy.
Yeah.
Men also do get cancer that is related to human papilloma virus. For example, they can get penile cancer, We see it more when in uncircumcised men. They can also get anal cancer, especially if they are homosexual. However, HPV causing cancer in women, there are also other cofactors. It's not just purely HPV.
Yeah.
It could be additional infections like STD, like chlamydia, for example. Immunosuppression, if your body is not very strong in immunity, because our bodies are supposed to fight off some of these viruses. We have innate immunity. They can contribute. Having multiple sexual partners, or your partner having multiple sexual partners. If you had intercourse at a very early age, it means you'll get the HPV when you are very young, and with the time it takes, it has a lot of time to change your cervix and transform to cancer. It is relative, because there are children who are raped when they are very small. But we know that there are studies which have shown, like in Kenya, people start intercourse at around the age of 13. So that is where our government is targeting these young girls before they get to that age, between 9 and 15 years. They get vaccinated before they become sexually active.
Okay, so Jen, ulifika SOS, ukaambiwa utakuwa referred uende Kenyatta.
Yes.
Okay.
Actually nitembea Kenyatta for 3 months. Nikingoja at least nione daktari. Sikufanikiwa. Rafiki mwingine akaniambia niende Dr. Plaza hapo tu Kenyatta. Nikapata daktari, wakanifanyia pap smear. Nikarudi nikachukua result, ikatoka cancer stage 2B.
Stage 2B.
Endometrial.
Okay.
Yes.
Okay. To put a pause apple, because we need to go on a break. But of course, when we come back, I would also want to understand, because Dr. Jen said something that after alichomo, right, she actually got pregnant. And you know, so many myths surrounding cervical cancer, and then you're not able to get pregnant. I'm pretty sure so many people are curious to understand how did that happen, but also to get to understand, so when did Jen start treatment and how is she doing right now? You do not want to miss that part of the conversation. Do stay with us. This is Health Diary. We'll see you shortly. All right, welcome back. This is Health Diary. My name is Winnie Lubembe, and today the discussion is all about cervical cancer. And we have Jen Awino Oke, who is a cervical cancer survivor, as well as Dr. Catherine Nyongesa, who's one of the top oncologists in the country, but of course at Texas Cancer Center. But right about now, so Jen alienda Kenyatta National Hospital, ukapata daktari. It was difficult for you, first of all, kabla upate daktari. And I'm just thinking, so before uone daktari, and already ulikuwa ushaanza kupata some of the symptoms. Unasikia unaumwa na mgongo, unaumwa na cramps. Uliendelea kusikia uchungu, uliendelea kusikia vibaya?
Niliendelea kusikia uchungu. Nikarudi Kenyatta. Juu aliniambia sasa nifanyie biopsy. Nilitembea tena miezi kama 6. So nikawa nimelose hope, nashinda nitafanya aje. Ndio daktari mwingine akaniambia kama naweza nifanyia kwa hospitali yake. Nika agree na yeye, tukaenda hospitali yake, akanifanyia biopsy, akarudisha. Akaniambia tena rudisha tu Kenyatta. Juu Kenyatta ndo tutafuta matibabu. Nikarudi Kenyatta. Hiyo ilikuwa mwezi wa 9 2020. Nikaenda Kenyatta, mali wanatibiwa kansa. Kufika hapo nikapea daktari. Daktari akanibook 2021 January ndio nafasi itapatikana. Nikawa sasa nimelose hope kabisa. So mzee wangu akapigia rafiki yake. Pia alikuwa na shida ya kansa. Akakumbuka alikuwa na rafiki yake, mamaka alikuwa na kansa na alitibiwa Texas. Sijui Texas ni wapi.
Okay.
Yes.
Kabla ufike Texas. Daktari, I'm concerned, right? Because she said it took a while before she got to see a doctor. So I'm just trying to think all this while waiting. What is the progression of cervical cancer?
Once you get the HPV infection virus, you may fight it off. And if it persists, it can take 10 to 20 years to actually become obvious cancer.
Okay.
After that, there's slow progression from stage 1, stage 2, stage 3, until stage 4. Unfortunately, you know, cancer diagnosis it's a multidisciplinary, even the treatment. First, you see your gyno, who will have a high index of suspicion that it's cancerous. Then from there, they have to take a tissue from the cervix. Then it goes to the pathology. These are different doctor who is going to check in the lab. It takes about a week or so to get the results. Then when you take back the results to your doctor, he has to stage you to know what stage cancer are you in. So that again involves another doctor who does in radiology. Then they get the report back and put everything together, then discuss on what is the best way forward for your treatment.
And then for her, she said she was diagnosed at stage 2B. What does that look like?
Fortunately, most women who are sexually active or they are married, they tend to notice these symptoms quite early. They'll have pain on intercourse. It's unfortunate for the women who are not sexually active. They never notice this thing, and actually they present a bit late when the bleeding is heavy, and if left unattended, you can have fistula. So the urine is leaking, the feces are leaking, and with the time it can break into the bloodstream and spread to other parts of the body.
So at stage 3 and 4 is where most of the time you see a lot of women coming to
unfortunately, because the symptoms of cervical cancer mimic other diseases. So really, it needs a very high index of suspicion and somebody to actively look for cervical cancer, maybe screen you to check for these symptoms.
For you, Jane, umefika Texas Cancer Center, ukaambiwa nini?
Nikafika, nikapata daktari hapo kwa reception. Nikawapea results zangu zenye niko nazo zote. Wakanituma MRI. Ndio waone kansa iko na wapi. Ndio wakati wataanza matibabu, watajua ni wapi wanatibu. So wakaniandikia nitaenda chemo 9, nitaenda radiotherapy 25 session, alafu akaniprefer ingine Nairobi Hospital, inaitwa brachytherapy. Yes. So nikaanza matibabu. Side effect ndio mbaya. Ilinilemea kabisa. Sasa mimi nilikuwa natapika na ninaendesha. Alafu kuna vidonda zilikuwa zinatoka huku sehemu za siri, mbele na nyuma. But sikukufa moyo.
So what determines what level of, or how many cycles of, let's say, chemotherapy, for example, or radiotherapy that one has to go through?
So the treatment for cervical cancer depends on the stage.
All right.
If it's picked like in stage 1, all you need is surgery. But when it's stage 2, 3 going onwards, you need multiple treatments. How many sessions, how many cycles of chemo you go for is based on science.
Okay.
There's a research that was done, and it showed that women who go through, say, 25 sessions of radiotherapy together with concurrent chemotherapy for the 5 weeks, they do better than those who do not get chemotherapy. Now, when it is in late stage, for example, stage 4, then the aim of treatment is, the goal of care changes to palliation. With palliative treatment, patients are generally very weak and they may not tolerate a long course of radiation. So with those ones, we give a short course of radiotherapy, like 5 to 10 days, just to manage pain and bleeding. And then based on how they respond, if it has spread to other parts of the body, the doctor will recommend that you get chemotherapy.
And then when it comes to like the side effects or the reactions of the same, what is normal and what is not normal?
Chemotherapy, you'll have nausea, vomiting, just lacking appetite, just feeling sick. In fact, it's worse than pregnancy.
Wow.
Yeah, you just feel like it's not normal.
Yes.
Yeah. Radiation, it's going to burn your skin, the back passage, the rectum, the genital tract will also get burns. The
is that
urinary
what she was
tract,
experiencing?
yes.
Okay.
So you'll have pain on passing urine, pain on going to the long haul. The goodness is that after you finish your radiotherapy, you start recovering. So these side effects are transient, and the benefits of treatment outweigh the risks that we get with the side effects. So we encourage women to go through because it's a life-saving treatment.
Ulienda brachytherapy kwa muda gani na sahi leo as we speak. Unaendelea aje? Ni lini ulikuwa declared cancer free? Tell me a little bit about that.
Linda 2 session 2021,
yes.
February ndo nimaliza matibabu. So nikakaa like 2 months, nikatumwa tena MRI. Wakaniambia, "Mom, congratulations. No evidence ya ugonjwa kwa mwili yako." Nilipiga nduru. But sasa wakaniambia nitakuwa nenda clinic after 3 months. So last month, this month, nilikuwa nimemaliza 1 year. Wakanituma pap smear. Nikaenda Kenyatta, nikapata daktari, akanichukua, akanifanyia pap smear. Akaniambia, "Jane, you are doing so good. Hakuna cells za cancer ziko kwa mwili yako." Nilishukuru Mungu.
How quick or when does one experience recovery? And then even after recovery, she also still had to go to the hospital for checkups here and there. Why are they very important?
Why it's important to continue with the clinic is because the doctor wants to monitor the response. At the same time, monitor for any side effects and how they can help. And also check out for any recurrence, for example, so that they timely intervene and manage in case there's any recurrence.
What are the chances for recurrence?
It really depends on the stage.
On the stage,
yeah.
okay.
So if it's stage 3, 4, the chance of recurrence are higher compared to stage 1 and 2.
In terms of then vaccinations, again, we know in the country the vaccines were rolled out to, the teenagers and preteens, right? But then there's also a question of older or mature women. Are they eligible for vaccination for HPV?
Yeah, you can get your HPV vaccine, but first you need to be screened.
Okay.
If you are screened and found not to have the virus, then it's a good opportunity for you to get the vaccine. Unfortunately, most of the time, mature women already have the HPV virus in their body, and so even if you give the vaccine, the efficacy rate is much lower compared to preteens who are not exposed to the HPV because they are not sexually active.
Can you take us through very briefly in terms of the treatment cost and the NHIF, how NHIF helps,
Cancer treatment is complex. It's not just one disease. It's a complex disease and it involves disciplines. You end up spending close to $500,000. You don't even know where the money came from.
So it's important for everyone to get NHIF?
Yeah. Because NHIF pays for, like radiotherapy, it has been paying for 20 sessions. So if you are to get 25 and 20 are already paid for, you are much better. Chemotherapy, it pays all the chemotherapy for the clients. And then when it comes to brachytherapy, which she did, each session it was about 40,000, so 2 is 80,000. So she still used NHIF to pay for that.
Understanding our healthcare system, right, in the country where Jane talked about an aspect of the delay, right? So what would you say to, healthcare providers, I would say, and hospitals in general?
I know the thing is awareness, education. We have the National Cancer Screening Guidelines. They are so clear and simple. Just go online, look at them, see what are the common signs and symptoms of cervical cancer. If a woman comes there, please check her. And also, these women are coming to the clinic. They're in childbearing age. They're coming to deliver. Take that opportunity when they come for antenatal clinic to do a pap smear. When they bring their children for vaccination, ask them, please just go and have screening for cervical cancer.
Dr. thank you very much. Jane, I want you to speak to the women who, number one, are scared, because Dr. talked about the important kwenda screening, but wanawake wengi wanaogopa juu tenda alafu wambiwe nini. So very, very briefly, just speaking to all the women watching us out there, unaweza waambia nini?
Mimi naweza ambia tu wamama wenzangu waende for screening, wajue hali yao, waanze matibabu mapema. Na nataka kupea hata wanaume ujumbe, kwa sababu kuna wanaume wanaotoroka. Mwanamke akishapatikana na kansa ameanza kubleed, hataki kusikia hiyo harufu, yeye anaenda kuenda. Nawaambia ni vizuri kusimama na familia yako.
Very wise words. Thank you very much, Dr. Catherine Nyongesa, who is an oncologist at the Texas Cancer Center, as well as Jane Awino, who is a cervical cancer survivor. Thank you very much, to both of you for coming by today and just helping us understand all about cervical cancer. And now we know better. So thank you. And of course, now it's the time for Health Tip.
So oral hygiene should begin as early as when a child is an infant, and parents can easily do this by using a cloth to wipe the gum pads, and when the child eventually gets their first teeth, then we can graduate to using a toothbrush. Breast milk has a lot of lactose, which can easily cause dental caries in a child. So your child should visit a dentist before their first birthday. We need to monitor growth of their primary dentition to see if everything is going well. We are able to catch any conditions like dental caries early. Also, we are able to advise on diet. Another thing, we can do dental sealants or fissure sealants to help prevent cavities in children. And we are also able to catch habits that some children may have at an early age. An example of such a habit is thumb sucking. Thumb sucking is normal until the age of 4.
Well, very insightful conversation we had on cervical cancer. And if you still have any other question, feel free to interact with us on our social media platforms. My name is Winnie Lubembe. Special thank you to 4 Points by Sheraton for hosting us. But until next time, adios.